pathological condition for pediatric population, that too related to musculoskeletal conditions, are very confusing to diagnose. And that is why in this question, this scenario, this situation, we are going to take it step by step and learn how exactly we can reach to the confirmed diagnosis. So the information provided in the question, the main informations are, the first one is the child is of 12-year-old and also male child. The second most important thing to know from the question is that child is having 28 BMI, which means child is definitely overweight, obese. Third most important thing is that recently we have experienced seeing growth spurts. Now for those of you who don't understand what do you mean by growth spurts, you simply have to understand that you will start noticing that extreme growth in recent days in a child. Like for example, recently the child is gaining weight too much, or height is increasing too much, bone length is increasing too much. So those things, if it is happening suddenly, we consider as growth spurts. The fourth information given in the question is that patient or child is limping, and also we are noticing there is an external rotation from the hip. So this is the again very important information in terms of diagnosing it, and we need to figure out what condition that patient is having. The option given to us are, the first one is legg-calve-perthes disease. The second option is SCFE, which is slipped capital femoral epiphysis. The third option is osgood-schlatter disease, and the fourth option is septic arthritis. Now from this given option, I am going to make this job very easy for you by eliminating two options which are completely irrelevant, which is option C and option D. Now why it is irrelevant? Because option C, if you go through it, is osgood-schlatter disease, which generally happens in the knee joint. That this is a condition of apophysitis of particularly knee joint. We will see the growth in the tibial tuberosity, and because of that the person has pain in knee, not in hip. Here the scenario given to us is about hip joint, so this option easily eliminated. The D option, which is linked septic arthritis, here in the question we are not given any information regarding that patient is having any fever or any symptoms related to sepsis or arthritis related condition. So that is why that option also easily we are going to eliminate. The remaining two options are legg-calve-perthes disease and SCFE. So let's discuss from these two options which one is correct. The first option, legg-calve-perthes disease, I will tell you why it cannot be correct option. The reason behind that is, first information, this disease happens in younger children starting from the age group of 2 to 10 years, maximum 10 years. It might happen sometimes in older adults or older children also, but very common in younger children. So that is the first point. And here the first information we are given 12 years of age group. So that is why I am little bit thinking about this option. Second option, we will not see obesity in this LCPD condition, because what exactly is happening over here, that because of the compression, the formation of the hip bone is not proper. It is going to go for necrosis. So weight bearing will be difficult and all those situations will be there, but there will not be any chances of obesity in this particular condition. So that is why that is not fulfilling the criteria given in the question. That is the second thing why I want to just eliminate this option. Third thing is, yes, there will be external rotation presentation, there will be limping present, but the other two are matching, other two are not matching. That is why I am not considering this option as the correct one. The second option, SCFE, slipped capital femoral epiphysis, why this can be the correct answer? Because the first thing first, it happens in little older children. So it can be possible, it will be happening in 10 to 15 years old children. Second thing, SCFE patients will have a presentation of obesity. You will see that those child are little bit obese. So that criteria also fulfills. There will be growth spurt present in this condition, because you will notice that these children are growing fast. Their fat accumulation is there, their bone height is increasing in recent times too much. So those all points will be there in this condition. Fourth point, yes, there will be limping, there will be external rotation presentation. So all the criterias are getting filled, and that is how we can come to a confirmed diagnosis that yes, this is the case of SCFE, in which, as the name suggests, there is a slipped capital femoral epiphysis. During the growth period, what is happening? Because of the overweight bearing, the proper acetabulum is not getting formed, and because of that the femoral head is trying to come out. To prevent that, to prevent weight bearing on that area, to avoid pain on that area, child is going to walk with external rotation, and that is what the presentation will look like. And that is why, yes, the here confirmed answer will be SCFE. If you want to learn more like this differential diagnosis step by step, then you must watch Physioquest series. And apart from this, if you still have any doubts, do let me know in the comment section.